Chapter 10 Therapeutic Communication. Communication is the reciprocal exchange of information, ideas, beliefs, feelings, and attitudes between two persons or among a group of persons. In other words, this is an interaction between two or more people. Those members of healthcare that work with mentally and emotionally troubled individuals, they become highly skilled listeners because communication is a big part of building that good rapport with the patient in order for us to actually be able to have that therapeutic relationship with our patient. It's very important for us to have a therapeutic communication. Theories of communication. We have Florence Nightingale and Jay Rouge. For Florence Nightingale, she emphasized the need to effectively understand and communicate with patients. For Jay Rouge, he saw communication as a circular process in which the message traveled from within one person to another person and then back again. It is actually in page 106, your figure 10.3. You can see in there that in figure 10.3, the person A makes the statement to person B, and then person B offers a statement in response to the message received from A's statement. He perceived it, analyzed it, and then interpreted it, and then actually respond to the message of person A. So it's like a circular process. Rouge called it feedback loop of information. He also said that therapeutic communication is distinguished from ordinary communications by the intent of one of the participants to bring about a positive change. Dr. Eric Byrne is another theorist for the theories of communication, and he used transactional analysis to refer to the process of investigating what people say and do to each other. He believed that three egos exist within all of us. One is the parent who focuses on rules and values. The other is the child who focuses on emotions and desires. And the other one is the adult who bases his or her approach to the world on previous observations. And he believes that when we're or individuals are communicating, we are actually using these three personalities: the child, the parent, and the adult. Which again, the child is the one that's actually more focused on their own emotions and what they want. And while the parent is actually the one that is actually focusing on the rules and then the values, and then the adult is actually the one that approached the world on previous experiences. By learning an individual's communication patterns, one is able to achieve more effective and fulfilling interactions. There are also other theories of communication that are focusing on other perspective. Some terminologies that we need to remember. You have kinesics, which is the use of the body language, and then your proxemics, which is actually focusing on how people use their space and channels of communication. Characteristics of communication. Human behaviors have a strong influence on communications. And then people engage in two types of communication. We call it interpersonal and interpersonal. And what's the difference? Interpersonal is what we call self-talk. And personal is when there's an interaction that occurs between two or more people. Interpersonal, this takes place within oneself and commonly referred to as a self-talk or self-dialogue. And everybody does this. Think about it. When you lay down in bed at night before you go to sleep, you actually have, or you're staring at the wall blankly, you're actually having that self-talk. You're actually trying to think of what happened on the day, or, trying to actually assess how you're feeling or how you were feeling for the day. This is what we call self-talk. And then you have the interpersonal, which is an interaction when one person is talking to another person. So there's two or more people involved. The verbal and non-verbal messages that are sent and received during interaction. Process of communication and the 5 elements that goes with it. 5 elements must be present for successful communication. What are they? Sender, messenger, receiver, feedback, and context. For sender, this is the one that forms and transmits the message. The receiver is the one that accepts the message. The feedback refers to the response of each person when messages are being sent and received. The context is the setting in which the communication is taking place. There are some factors that influence communication: culture, social class, relationship, perceptions, values, parts of the message or the content of the message. And as a healthcare provider that actually takes care of a multicultural population, it's very important for us to know these factors that influence communication. And like we said, one of them is culture, and social class is the other one. Culture, there are some cultures that is actually going to be different than you as a nurse taking care of the patient. For example, there are culture that would actually prefer for a less talk, right? There's culture that actually talking a lot is okay. Or for another example is there will be culture where when you're communicating to someone, it's very important for you to actually have an eye contact with the other person. While there are some cultures that it's actually rude, like in Asian cultures, it's actually rude for us to be talking to an adult or to an older person, and we're actually looking at them straight in the eye. So it's like there's differences, practices in differences cultures. What about for social class? So go to page 105 in box 10.1. It's important to know this. This is how communicating with patients of different classes is supposed to happen. Number one, show acceptance and respect for the person. Consider the environment in which clients must cope, especially those from social classes of poverty. Assess the patient's pattern of communication, both verbal and nonverbal. Use terms that the client may understand. Avoid using medical terminology. Do not talk up or down to the clients. Ask patients to highlight any terms that they do not understand, and invite the patient to take an active part in the treatment plan and its activities. So two things in here that I want to point out. It says use terms the patient that can understand, and avoid using medical terminology. So when we're talking to patients, it's very important for us to have that therapeutic communication that both the receiver and the sender actually can understand. For example, I'm the nurse that's taking care of a patient that is recently diagnosed with maybe malignant melanoma. For the patient to understand their diagnosis, I need to actually not use medical terminology, right? I have to actually simplify it to the level where the patient can actually understand what I'm talking about. So instead of me saying, oh, you have a melanoma, or malignant melanoma. I can say, you know, you have a diagnosis of skin cancer. So it's actually a simpler terminology that my patient can actually understand. It's very important. It's very important when we're taking care of patients. And then another one is do not talk up or down to clients. So if you're talking to a patient, you have to remember that you have to talk to them in the eye level. So for example, your patient is sitting down and you as a nurse is taking care of the patient and you're standing up while you're talking to them, it's not really giving that therapeutic communication style to the patient because it's looking like you're talking down to the patient. So grab a chair, sit down at the eye level so that you can actually on the same level as the patient, because it's going to send that good message that, I'm here to talk, I'm here to listen, and I'm not here to talk down on you. Levels of communication: verbal communication and then nonverbal communication. Verbal obviously relates to anything that is associated with this spoken word. Understanding the verbal messages involves the ability to form abstract ideas and concepts, and very important to remember that it represents only a small part of an entire communication. And what does it mean? It means that in addition to the verbal communication, we as healthcare providers, or we as a person actually, needs to be very mindful of our nonverbal communication as well. For example, if I'm the nurse taking care of a patient for the first time, and I'm going inside the room and tell my patient, "Hi, my name is Salvi and I'm your nurse for today." Yes, my voice is in a professional way. I did not say anything that is inappropriate. However, my nonverbal communication also needs to match what I'm talking about. What if I'm saying, "Hi, I'm Salvi, I'm your nurse for tonight," and yet when I'm doing that, I was actually, you know, rolling my eyes, or I'm holding both of my hands in front of my chest, or I'm not even, looking at my patient directly. I was actually maybe on my phone or maybe in my laptop, then my nonverbal gestures is not matching with my verbal communication. It needs to match. Um, and like we said, that nonverbal communication actually plays a big part. Plays a big part of an entire communication. And that's what we mean when we say represents only a small part of an entire communication when we're talking about the verbal. Nonverbal, of course, it's the messages that's sent and received without the use of words. Messages sent at the nonverbal level are expressed in at least one of four ways. Appearance of the person. Do you appear pleased? Do you appear happy for the patient? Or do you appear like you're upset or you're frustrated that you're taking care of this patient? Body motions. Like I said, what if I'm actually rolling my eyes, or what if I'm actually holding my both my hands in front of my chest, so it's not actually showing that um, I'm actually being very welcoming to the patient. Use of space. What if I'm too far from the patient and I really don't mind, getting into that level or that space where my patient can actually hear me? What if I'm too close to my patient that I'm actually um, invading that personal boundary already? Non-language sounds, very, very important to remember for us as the healthcare providers. Non-language sounds, like, when you're sighing like like that, that's actually a form of communication too. For example, what if my patient is actually saying, Oh, what is in this cup that you gave me? Can you please tell me all these medications that is in the cup that you're giving me? And the nurse would say, and yet she still told the patient what are those medications. So yes, you did what you're supposed to be doing. However, your non-language sounds is not matching your verbal communication. So it's like I said, it's very, very important to remember that both of those two levels of communication need to match and to work together. All right, intercultural differences. To fulfill basic needs, people must interact and communicate with each other. In the healthcare world, as a nurse working with a patient, there's just no way that we can take care of a patient without communicating to them. And we cannot take care of a patient properly and effectively if we're not going to communicate to other healthcare providers like other nurses or other disciplines like your therapists, your dietitians, the doctor. So it's very important that people must interact to communicate with each other. Cultural communications may differ in terms of the following: the communication styles, the nonverbal behaviors, the values, and the language itself. Therapeutic communication skills. The goals of therapeutic communications are to focus on the patient and to foster the therapeutic relationship, meaning we have to build the therapeutic relationship or that good rapport with the patient. Therapeutic communication techniques are divided into two areas. You have your listening skills and you have your interacting skills. How do we actually be a pro to the listening skills? Well, we gotta concentrate on the speaker. You gotta make sure that you're listening to the patient. For example, if a patient is talking to you and say, "Hey, nurse Salvi, can I talk to you?" And I would say, "Yeah, yeah, 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 we can talk." And yet I'm typing my laptop or I'm playing with my phone and not even talking to my patient. And my patient keeps talking and talking and talking. So I'm not actually showing a good listening skills. What I need to do is to actually stop what I'm doing, right? Look my patient in the eye and then actually listen and concentrate on what my patient is saying. Listen objectively. I just explained it. Make sure that nonverbal messages match verbal message. We gotta follow up. For example, if the patient is actually trying to tell you something and you want some clarifications, make sure that you make a follow up and clarify. And then we also need the interacting skills. Interacting skills is verbal and nonverbal responses should encourage clients to communicate in a way that encourages growth. Therapeutic communication. There are things that actually will happen or can happen that could result into a non-therapeutic communication. Some of them are like messages that hinder effective communication or some barriers to communication. Um, it could slow and halt the development of a helping or therapeutic relationship. Some barriers to communication you have in page 112 is actually showing you some problems with communication, like your aphasia. What's aphasia? It's an inability to speak. The dyslexia, which is impaired ability to read. Speech cluttering is rapid, confused delivery of unrhythmic speech patterns. And then in your table 10.2, in page 113, this box actually is very helpful and we should actually have some time to read this. This is non-therapeutic technique and it actually gives us the description of each technique and then it gives actually an example. So let's actually get some samples from this table 10.2 and page 113. One is, let's look at parroting. Okay, what is parroting? That's a non-therapeutic technique. The description is a continuous repeating of client's words. For example, the client said, I haven't slept in 2 nights. And the caregiver is like, you haven't slept in 2 nights? So instead of actually doing this, parroting, you can actually do or say, what do you think is causing this? For us to be able to do that therapeutic communication. Another thing, being defensive, also big thing. Being defensive is an attempt to protect something or someone, prevents patients from communicating. So, for example, the patient said that last nurse is a dope, and then you say, oh, all of our nurses here are highly trained. So, it's like you being defensive to what the patient is trying to tell you. Instead, what you want is for your patient to actually elaborate, right? Instead of that, you're going to say, what makes you think that? If you ask this question, that patient is actually going to elaborate what they mean. And that is actually therapeutic communication versus this non-therapeutic communication. So take your time to actually read this table 10.2. It's very helpful. It's non-therapeutic communications. In addition to that, box 10.5 is actually talking about therapeutic communication techniques, listening, broad openings, restating, clarification, reflection, humor, informing, focusing, sharing perceptions, theme identification, silence, and then suggesting. So, for example, let's pick one or two from here. Listening. The definition is this is an active process of receiving information and examining reactions to messages received. Example is maintaining eye contact and receptive nonverbal communication. The value is there's a non-verbally communicates caregiver's interest and acceptance. Okay, so please take your time to actually read box 10.5 and box 10.2. For it's very helpful for therapeutic and non-therapeutic communications. All right, some methods for coping with barriers to communication. Number one is to recognize that a problem exists. We have to actually acknowledge that there's a problem for us to do something about it, right? Identify what purpose or need the problem is feeling. Explore appropriate alternative behaviors. Like I said, pay attention to your box 10.5, 10.4. Implement alternative behaviors when interacting. Um, One example of this is what if you're talking to a patient that is actually um, being talkative or is actually trying to share something, and all of a sudden this patient actually stops talking, right? Maybe they became sad. Okay, so implement alternative behaviors when interacting. You gotta adjust to how the patient is actually or how the other person is communicating to you. You cannot be continuing talking too much when the patient is actually stop talking already. Okay, evaluate whether communications have improved. Problems with communication. So one is communicating with mentally troubled patients. Problems with communication are a common feature in many forms of mental illness. To communicate effectively with mentally and emotionally troubled patients, we gotta realize that every interaction is a part of the total therapeutic process. Every time that you have that interaction with a patient, with a mentally troubled patients, is significant. It's important for us to assess, continue to um, have that building rapport, good rapport with the patient, and continue to actually evaluate the patient. A climate of trust and respect must be established, and the patient needs a routine. Okay, for mentally troubled patients, routine is very important because they need to see consistency. If they see that the healthcare provider that taking care of them are actually inconsistent, they're not actually going to be compliant with their plan of care too. So that's why it's very important, um, that we actually have to have a routine. We actually have to have that pattern or consistency for us to actually have or that good rapport with the mentally troubled patients. One of the most important tools for communicating with mentally ill patients is effective listening. And I do not know how I can emphasize this. It's always this effective listening when we're taking care of mentally ill patients. They just want to be heard, okay? And like we said, bottom line is your verbal gestures need to match the nonverbal gestures, because we have to make the patients somehow feel that, we truly care, we genuinely care. My actions and my verbal words are actually going to let you know that. Okay, and that is chapter 10.